Welcome everyone to the latest webinar from Coronis Health. This is a joint webinar with Mingle Health called Succeed with MIPS, how to avoid the 9% MIPS penalty and prepare for success in 2022 and beyond. We have a phenomenal speaker lined up, but first I am going to introduce you to Melody, who's also a great speaker, and she is the Director of Operations from Coronis Health. She's been doing in this space for 20 years and with Coronis Health for 10 years. And she is zooming in today from Detroit. So welcome, Melody.
Thank you, Risa, and hello, everyone. Today, we are here to talk about the four-letter dreaded acronym MIPS. Thankfully, we are here to help. In this webinar, we will discuss how to determine if you're MIPS eligible, how to avoid the MIPS penalty for the remainder of the year, and how to plan for success in 2022 and beyond. Therefore, I'm extremely pleased to announce that in order to support our dedicated clients with all of your MIPS needs, Coronis Health is partnering with an expert in MIPS with preferred pricing. As an industry leader in quality reporting and analytics, our partner, Mingle Health, has streamlined MIPS and ACO reporting to help you avoid penalties, improve scores, and increase quality earnings. With that, I am happy to announce our speaker, an expert in all things MIPS, Allison, the VP of Client Services at Mingle Health. Allison is a board-certified informatics nurse with experience in Epic, Healthland, Meditech, and many other EHRs. She has specialized expertise in regulatory reporting and population health management. In her role, Allison leads the client services team at Mingle Health, ensuring providers and organizations maximize the benefit of their investment in value-based care programs and Mingle Health solutions. Allison today is zooming in from Omaha, Nebraska. Back to you, Risa.
Thank you so much. So before we get started, I'd like to do a quick poll just so we can a little bit better understand everyone that we are speaking with. So a poll should have just popped up on your screen. So the first question is, what is your medical specialty? Are you in primary practice? Are you a specialty physician, any subspecialty or other? Second is, what is your position? Are you a physician, a PA, a practice manager, or practice admin? Third is MIPS a challenge for you? And I imagine the answer would be yes, or you would not be tuning in today. It's a challenge for many of us right now. And then the most important one, which is you can check all that apply, is why are you joining us today? We want to make sure that we give you the information that you are looking for. So are you struggling with MIPS participation? Are you new to the program? Do you want to learn how Coronis Health will assist you with MIPS? Do you want to understand the MIPS requirements? Or do you need help improving your scores? So I'll give you all a few seconds with some elevator music.
Actually, while everyone is working on this poll, I'm happy to kind of talk briefly about what we're going to discuss today. What we're really going to talk about today is essentially why this program matters. What do we have to gain and lose, and how to get the most out of it. And we'll be sure to leave time for a Q&A because the program really has a lot of variation depending on your practice. So it's really important to address questions specific to you and your unique situations. So don't hesitate to enter your questions into the chat box if they arise before we get to the Q&A session.
Great, thank you so much. So not all of you are answering our little poll here. So last chance to get your questions in or your answers in. And I'll close this down and share the results here. So Allison knows who she's speaking with today. So it seems like most of you are physicians. Most of you are specialty physicians. Then we have practice managers and practice admin coming to join us today. MIPS is a challenge for everyone. That's why you're here. And why are you joining today? The most common answer was to better understand the MIPS requirements. After that, to help improve your scores. And lastly, struggling with MIPS participation. So Allison, what do you think? Can you answer all those today?
Yeah, absolutely. I'm actually really excited about this group. This is a good group to have this conversation with. We know that by and large, administrators and office managers at the practice level are really helping the providers get their submissions in and doing a lot of that administration stuff on the back end. So we're in good shape. So let's go ahead and get started. Quality payment program, right? Or what we sometimes call the QPP. It has two pathways. We've got an advanced payment participation or an APM participation and MIPS. So at Mingle Health, just so you're aware, we support both. Our webinar today is going to focus really on the MIPS program. In that MIPS program, you're trying to get as close to 100 points as possible, and each category is going to carry a different weight of those points. So there's some math that we'll calculate and display for you, so you don't have to worry about that beyond really understanding the basics. In addition, some reweighting of the categories can occur because not all categories will apply to all practices. But there are times where your practice may not be required to participate in a given category, but it might still be in your best interest to do so. So this is part of why we pair our technology with an assigned consultant so that you have a subject matter expert available to you to understand the strategy of that choice and to help make the right decision with you. So quick overview there of what MIPS is. One really important thing to know is that the project of reporting MIPS is really a 15-month project. So we have the performance year, which is the calendar year of 2021, right? And the submission period, which we know extends from January 2022 through the end of March. You've got to get your submission in by the end of March. The payment year, by the way, is 2 years after. So you see payment reimbursement based on the work you did today during 2023. The "you are here" arrow, right? It's simply pointing out that since this is a 15-month project, if you haven't started, we're 10 months in already. Now, it isn't too late, but if you still want to end with a strong submission this year, you need strong engagement, getting data, commitment to reviewing that performance, and some prioritization of resources. Our consultant team are full of experts in this to really guide us from where we are today to submission. So let's take a look at the category weights. Now, by legislation in 2022, quality must be worth 30% of your total MIPS score, and the cost must be at 30 as well. Although there are some annual updates to the QPP program, some fundamental rules can only be adjusted by an act of Congress, and that happens to be one of them. I'm going to go ahead and show you the others here. There you go. Because of the national health emergency, we've been provided some exceptions. For instance, in 2020, the cost category wasn't scored at all. Now, those exceptions aren't going to continue for the life of the program because it's legislated that the program must reach what they call full maturity. And I'll talk about that more when we get into incentives and penalties in a minute. There may be reasons some categories don't apply to every practice as well. So it's part of why working with program experts is important, because you want to understand the strategy behind that decision, like I mentioned. But we'll discuss some of that in our breakdown of the categories. So we have 4 categories, and this is if there's no reweighting. So here are the points out of 100 each category will be worth. One thing I want to point out on this slide is that notice that quality and cost has to be a full year's worth of data, where improvement activities and promoting interoperability is a selection of 90 consecutive days. That means we get another strategic decision to make. Which 90-day period across the year is going to garner the best score? So we're going to dig deeper into these categories, but I like having them here in one place for you, and we'll make sure everybody gets a copy of the slide deck when we're done. Let's talk incentives. Here's what's really at stake for the practice. So the MIPS program has what we refer to as budget neutrality. This means that although the penalty percentage, which is there at the bottom, what CMS is going to refer to as a downward payment adjustment, but us average people call it a penalty, that is a static number. So this is established by legislation. This means if you do nothing, if you don't participate, you receive the full 9% penalty. Incentives, however, are budget neutral. So all of the dollars collected from those 9% penalties are then redistributed across successful practices. Now, what we see at the beginning of the program with the bar to success being low is that the incentives are low, but the program continues to raise that bar. The harder it is to achieve success, the more people end up in the penalty pool, which means the higher the incentive amount for succeeding. We anticipate that as the program matures, we'll achieve these larger incentive percentages like CMS talks about when they say a plus 9%. But that transition period to a really fully mature program takes time. So as an example, to give you sort of the real world feel of this, we just received feedback reports for 2020. And those who achieved perfect scores so far in 2020 are earning just about a 2% incentive. But let's think about what 2020 was actually like. There were COVID impacts, lots of practices exempted themselves from participation. So of course, that means there are very few penalties that get assigned. Again, those exemptions don't last forever. It's just a good idea to plan ahead and ensure that your practice will have access to the greater incentive dollars that are likely to come. And again, it takes time to drive that improvement at your practice. So the more proactive you can be, the better off you usually are. So speaking of penalties and increasing difficulty of this program, this is another slide I just really like having in here for everyone. This year is going to be a tricky one. If you're not intentional about your score, it really easily can get away from you. 2021 really represents the first time where this is no longer a passive program. Being successful in it really does require participation, focus, and for some practices, quality improvement efforts. So the blue square that we've highlighted here is the 2021 performance year. Notice that that top line tells us the payment year, right? So again, that's because we're receiving the payments for the work we do 2 years later. Here's why we think we will see more penalties and incentives related to the performance of 2021. The threshold to avoid a penalty is now 60 points out of 100, and you need to earn 85 points out of 100 in order to be eligible for what's called the exceptional performance bonus. So with that moving up to 60, there will be practices, sometimes even good practices, who start to see slight penalties, right? You know, in general, what we're hearing is that really only very proactive, those excellent practices engaged in the program end up really achieving incentive dollars. And I think, Risa, you have a poll about this, right?
Yes, I do. So here you guys go. So based on the new 60-point threshold, do you believe your organization is on track to avoid a penalty? Yes, maybe, no, or not sure. And this is anonymous, so don't worry, we're not judging. And Allison will help you figure out the solution.
Yes. Yeah.
Either way.
Regardless of where you are. Exactly. We really pride ourselves on meeting our clients where they are and just bringing everybody up. One of the things that I really do want to say, and I'll mention this more as we go forward, is that even if you've done absolutely nothing for this year so far, it's not too late. Our consultants do a really fantastic job of meeting our clients where they are and catching everyone up.
I can imagine there's a big sigh of relief for some of you. No, we can't hear you. I felt it myself.
Yeah.
All right. So last chance to get in on this poll. Some of you are being a little shy, but that's okay. All right, here we go. Allison, here is where everyone is at right now.
Wow, look at that. So there's a lot of yes. There's some not sure, and some, maybes, and a few little no's. Okay, that's okay. There's actually quite a bit of range in there as far as this entire program and what we're seeing on this slide. So let's dig into a little bit of the details, right? We said excellent practices are the ones who achieve incentive dollars. So let's talk about how do we become exceptional, right? The first thing to do is show up and participate. And everybody who's here has done that today. So I say great job, right? Participation will get us through 2021 and allow us to plan to be incredible in 2022. Right? So in order to do that, always our recommendation is to start earlier. The good news is that when you work with us, we have a 12-month or a 24-month renewing contract. So what that means is we don't stop working with you at the time of submission. Right? And that's actually how a lot of practices fall behind. They focus on the current year submission only. And then, oh my gosh, it's so exciting to take a break through the spring and summer, except that's really when it's time to dig into why your systems are reflecting measure performance that's lower than desired so that we can improve it together. Our goal is to help you be a successful practice and achieve the goals you set for that performance year. So in that work, we're going to help you understand clinician eligibility and how it changes throughout the calendar year, which it does, for those of you who aren't aware of that yet, and what that means for your practice. We talk early with our clients about improvement activity projects and the promoting interoperability measures so that we're sure to have a good choice of those 90-day periods in which you can report those categories. We'll help with the quality category, quality improvement, and of course, prepare your practice for submission if that's in the best interest of the practice for that year. And I say that because for some practices, it might be a smart strategic decision to take what's called an EUC. It's an emergency exemption for the current year, and you can take it on different categories, or you could take it on all the categories, and those are strategic decisions too. But the idea is perhaps we do that, and that allows us to expend our effort and our resources to take the time to get stronger, better results for the year following than if we have the distraction of a last minute submission. Because again, that submission period is going from January to March, which is also the first of next year's performance period, right? We like to refer to that as quarter 5. So our program experts are going to help with all this because honestly, we've just learned over the years that MIPS is not a one-size-fits-all path. Recommendations are always tailored to each practice that works with us and Coronis Health to really meet the practice where they are and to get the best results possible, easing the burden of reporting these programs and always taking your clinic effort and resources into account. And that's just all a part of our standard MIPS offering, right? So let's move on to digging into this a little deeper. So organizational goals. Our first recommendation is going to be to set an organizational goal for both 2021 with an understanding of what work you've done so far and 2022. This is a fantastic opportunity for discussion and buy-in at your practice. So again, for some, maybe you're going to say, I want to avoid a penalty this year, and I want to maximize my positive adjustment for next year, really drive that quality improvement, engage the stakeholders, talk with clinicians about how this can positively impact patients. That being said, there are some practices who really just want to check the box and avoid a penalty year after year. We can support that too. It really is geared toward what your goals are. I have prepared for APM participation on here because CMS really appears to be nudging more groups toward participating in advanced payment models. So if you are joining an ACO or you're looking to participate in a prospective payment program like Primary Care First, those are things we can help with too. Hopefully everyone is familiar with this beautiful screen. If not, this is the link where you look up your NPI. So this is a CMS official result. This is what your particular NPI is getting judged against as far as eligibility is concerned. So if you feel it's incorrect, you want to reach out because we can help support you in that conversation with CMS and getting those things rectified. The Mingle Health system is also going to pull this information through an API automatically for you. And those are conversations, those eligibility conversations are ones the consultants are really well versed in. Special statuses is another piece of eligibility. They are also displayed. You'll see them in the lookup tool. They're very individualized. You'll see them also in our platform. The best plan is really to review this with your consultant. There are 2 determination periods at which these statuses could deliver a published change to the official CMS source of truth, which is the QPP. There's still possibility for eligibility and status to change this year. Consultants are really keeping a close eye on these periods, and we know when new statuses are published, and we communicate with our clients about, hey, it's time to go look again, right? But the determination periods are here for you as well, and some of these special statuses that you'll see. So next is improvement activities. Improvement activities are really projects, right? Ideally, these are projects you should already have underway, because the deadline for your last 90-day period of the year was October 3rd, 2021. If you have not selected your improvement activities, you haven't started any of your projects yet, then honestly, the goal for this category for you for this year switches. It switches from what improvements do I want to make to how do I leverage the work I've already done? And again, you work with your consultant, and we can help understand your practice and make some recommendations for you, so you're not feeling overwhelmed by looking at a list of 90 plus projects, right? All of the activities on the list are at least 90-day projects. There are some that are longer. They also are auditable. So that means in the event of a CMS audit, you need to be able to provide proof that you completed that activity. That is not as straightforward as a numerator and a denominator in a quality measure, right? So CMS publishes what they call data validation criteria, and that is really what helps us make sure that we're prepared for audits. You want to read it really carefully. Things that sometimes seem straightforward by a title need a second look. Sometimes there are, our consultants will understand the options really well, and again, provide recommendations. And in really interesting cases, we go directly to CMS and advocate on behalf of our clients. And through that audit process, we encourage our clients to let us know if CMS audits them, so that we can sort of swoop in and provide some additional support if needed. This slide has a lot of information on it. This is our promoting interoperability measures, and it shows you the scoring and any really key additional information for the measures this year. So one thing to call out here that is new is the HIE alternative measure. It is a yes/no response measure. One thing I want to say about the yes/no response measures is that they are really, really easy to attest to. And again, they are subject to audit. So you need to be able to make sure that you're getting the right screenshots to prove that you actually did have a bidirectional exchange in that case for your yes/no measure. And again, you need a 2015 edition cert to do promoting interoperability. And October 3rd was the last day that your 90-day period performance can begin. So what we do is we review the entire category for PI with you throughout the year. The idea is we're trying to sort of troubleshoot performance. Workflows are the lifeblood of the PI section. You really need to follow the recommendations of your EMR. And we have experience in hundreds of different EMRs across the country. And in some cases, we've worked directly with them. So advocacy, I think, is one of the things that I would say that we can help with. This category can be challenging. And the reason I think it can be challenging is because sometimes it feels like you didn't do it right. And you're hearing from your vendors, well, you didn't click the right button. So I simply just tell people, we need to be a resource or an ally, because we can really help drive those conversations with the EMR vendor. And our consultants are not afraid to get on calls with you, with your vendor, if that translation is helpful. And all of your points are here, so you'll be able to kind of take a look at that as well. All right, now we get to the big category. Here's quality. This is, you want to understand your year-to-date quality performance. This is a screenshot of what our quality dashboard looks like. So this year, quality is worth 40% of your MIPS score. That's worth more than any other category. So you would have to perform perfectly in every other category in order to avoid a penalty if you're not submitting quality. That's really part of why we are saying that this is the first year that you really need participation and focus to get it done. Measure selection does have a strategy behind it, right? You want to take a look at not only the effort that it could take your practice, depending on what data we would need for numerators and things like that. So you look at the number of patients or your patient visits, but how that measure can score. So there are bonus points available. And the consultants truly do help with things like accessing that numerator data. We can run some analytics on the back end. So if you're looking at this measure and you're saying, hey, my performance rate, say on our second measure down, 112, is 34%, but I know internally we're really, really good at this. Can you help us understand why my score is 34%? Absolutely, right? We have clinical informaticists who dig into this data for you, and we share the information back to you. You can share it back to your team. The truth is, your practice best and what and where your doctors document. So we can tell you where it is and where it is not worth your effort because we know the program. So it's really putting those two pieces together, right? It's the workflow plus the program. And this is really allowing you to make sure you get the best points possible for the participation that you can do. Measure score changes. This is just another piece to be aware of. So reporting the same quality measure year over year actually is a really good way to see evolving practice improvement and to help your staff feel like they're part of sort of a larger initiative of improvement. The challenge is that measure details change. So, and sometimes they change year to year. So it can mean that doing the same amount of work results in a decreased score. But knowing these details is really a part of our expertise. This is a report, an analytics report that we run frequently for clients, especially early in the year when they're getting involved. We can help with these challenges. One way to understand your prior year feedback report and to really understand your level of success as a practice in this is to understand how CMS has judged you in the past. So the feedback reports are really your practice's report card. And it can be a strong indicator of how you will be judged in the future, not necessarily how you will perform in the future, right? Because we've talked about how the measures change. Maybe your level of effort has changed, or your ability to prioritize the program has changed. But it definitely will give us insight into how CMS views your practice. So we can take this information, we can help make strategic recommendations over multiple years moving forward to really ensure your personal practice success. And I think, Risa, don't you have another poll about participation?
I do. I have our final poll here. So here we go. So how did your practice or organization score in 2020? Are you 85 plus, 45 plus, 30 plus, received a penalty, you didn't participate, you got an exemption, or you're not sure? This is anonymous and every answer is okay. So just give you guys a moment or two.
And no judgment on any of this. There are there are clients I've worked with who understand the program, participate in the program. They, not aware that the feedback reports are out there or where to find them. Right. So then how would you know what your score was? And that's okay. That's something we can help with too.
All right. Here are the answers for those of you that were brave enough to share.
Yay. Couple of, there's an 85 plus up there, high five. And a couple of 45s, and there's some, a lot of people last year, I think, took exemptions. The year that COVID really impacted us the most and was surprising us the most. I think for a lot of practices, we're kind of getting back in our groove and we understand how COVID is impacting us, and that's been really helpful. Okay. So this is a slide that really talks about our project plan. This is the work that we do with our clients every day. Honestly, we've been doing quality reporting for years. So Mingle Health has been doing it prior to MIPS. We were originally working in the PQRS program for years. What we've done is really lay out the best opportunity for success. That's our project plan with you. What we do is we customize it to achieve the goals that we discuss with you in our kickoff call. So we really feel strongly that following these steps is what allows practices to achieve excellence. And where the blue arrows are down here, you can see we've got a line that starts with upload data. So we're uploading data, we're doing measure selection with you. And then as that numerator data comes in, which can come in through a wide variety of sources, it's a bit of an iterative process, right? I want to give me some data. Let me show you performance. Now let's dig into that performance. Let's do a gut check on it. Let's validate it. Does it feel right to you? If not, let's dig in and find out why not. And then maybe we make a request for additional data. It's not always my performance is low because my clinicians aren't doing it. Sometimes my performance is low because my clinicians are documenting in a way that we didn't expect. Okay. There's over 800 EMRs across the country. Absolutely, every user in some cases is going to come up with things we never would have thought of in the way that they're pulling it. It's okay. So we take this iterative approach to it to get you better and better and better performance. Really take into account what's right for you and the resources that you have. So this gives you a good overview of our entire project plan, which again, of course, at the very end, we have a little submit to CMS button if that is what's right for your project, for your practice strategically. So here are some areas to think about, right? We wanted to really close strong with some places where you guys can really kind of dig in and think about your own practices. This is really how to be successful, not just for MIPS, not just for the QPP, but really how to be successful in your practice. So our first one is take care of patients. I mean, this is why everybody got into medicine, right? We want to have patients who are as healthy as possible, and we want to keep them there. And that really is the first step being on a pathway to value-based care success. Second is using your EHR effectively. So it's equally important to document the strong care that you're giving, really in order to get credit for that care. I've talked to many clinicians who say, I feel like I do this very, very well, but then when I look at the metrics, it feels like the metrics aren't telling me that story of how well I do, right? And that sometimes that's just a data issue. So let's solve the data problem. Let's not try to solve the clinician is not doing it correctly, right? So that's why being patient-centered and focusing on those outcomes is first. Value-based care. So this goes into the next two big blue bullet points, which are you tracking your patients' needs that fall outside of your practice and outside of your exact care can be really important. You want to manage those transitions, or at least understand where they are happening. Understand when, if I'm a primary practice, if I'm referring that patient to cardiology, did my patient show up? Did you see them? Am I getting some communication back from you as far as a plan and what we're going to do from here? And really, it helps us manage all care, not just chronic disease. And also being selective about who's in your care network, meaning know who you're referring to, who you're taking referrals from. That's really helps with good care because that's how you are being represented as well across your community. So it allows you to be represented positively for the patient. So everything that we've discussed today is really designed to help you understand how the MIPS program works, what's changed for 2020, and how Mingle Health can really be a partner in that success for you. So just as an overview highlight, when you work with us at Mingle, you get a dedicated consultant who guides you through every step of the way. You get access to our software and expertise throughout the year. And we do have both chat and phone and email availability so that you guys can really reach your consultants as you need. We help you be prepared for changes to the program as the penalties increase. And you have access to a lot of our tools, which are things like measure analyzers and measure advisors and our dashboards and increased, sometimes even custom analytics. Most importantly, you can really just rest assured you're in good hands and that your organization is going to be protected from penalty. But I wanted to thank all of you for your time. Let's move to some questions. Here's contact information. Absolutely, if you have questions, please feel free to put them in the chat box now. And I've got some questions that were pre-sent in that I'll go through while we're waiting for the chat to fill up.
Great. And yes, just as a reminder, this is the time to use the Q&A feature, ideally on Zoom, to populate your questions. We see a few coming in already.
Oh, good.
And we will try and get to as many of them as we can. So thank you, Allison.
Sure. So this question that's in front of me, Amy has asked us, I have a large group with multiple locations. How does Mingle support us when we have different EHRs and systems? So qualified registries, which is what Mingle Health is, that's our relationship to CMS. Really our bread and butter, the place where we live, is the ability to combine that data across different EHRs and systems. So we can show you a breakout of how your different locations perform. We can show you not only by TIN, but also by individual provider. And because of the way we bring data in, we take billing data as our denominator, and then we match it to numerator data, which would be more customized to in each individual practice. And we're pretty comfortable with what we can get out of each EHR and different system. So that ends up being a really customized conversation with consultants, but we can absolutely support multiple systems. Jeff asked, I know the maximum penalty is 9%. And that's if I meet, and he's asking if I meet some, but not all of the requirements. For example, maybe he can't find 6 quality measures. Am I correct to assume that the penalty would be significantly smaller? Yes. So there is a penalty threshold, right? Which we talked about, that in order to avoid a penalty entirely, we've got to get above that point amount. Penalty mitigation is also a thing, and it is becoming a little bit more prevalent as the program is getting more and more difficult. There are some practices who simply don't have the resources, don't have the people to expend to an effort. And so if you don't have what you need to avoid the penalty entirely, you can mitigate that penalty and you would receive a smaller penalty than the 9%. Like I said, there are also exemptions and things like that in many cases may be worth applying for. It might be better for you to apply for, say, a reweighting in quality entirely than it would be to try to just mitigate that penalty. And again, our consultants are really fantastic at that. Larry asks, can you explain the option that allow practices to reweight the QPP categories? So I can give you some examples. Those CMS special statuses, that's one way that categories can be reweighted. So for example, if you think not about a primary care practice, but maybe a non-patient facing provider like a pathologist or a radiologist, they're not going to be documenting promoting interoperability in the EMRs, and CMS understands that. So by having that special status, that's what's allowing that entire category to be reweighted. And obviously, like I said, there's opportunity in the hardship application. It's a strategic decision. You have to sort of weigh COVID, any other challenges you're having. Small practices have some really unique challenges that we're very familiar with. And again, I would just recommend engaging with a consultant to understand really what that looks like for your practice. This is a really good question. If we applied for the hardship exception and were approved, do we still need to do PI, promoting interoperability with the state? So promoting interoperability is a category in the MIPS Medicare program, but it's also one in the Medicaid program. Now, the exemptions that we help our clients apply for are only applicable in the Medicare program. There may be exemptions in Medicaid, but that varies state by state. So you really want to explore in detail for your state if that exemption will hold. And the state Medicaid reps can absolutely answer that for you. Sally, what should I be thinking about to maximize our success in 2022? I think at a high level, the things I would be most focused on is if what you want is to maximize success for 2022, you want to get data to us. I like to say early and often. Understand where your numerators are coming from. If you are applying claims codes, for example, we can pull those and pull a numerator from that. If you are not in a claims code workflow, but you want to be, setting up that workflow and understanding it is key. If you're not going to do claims codes at all, and instead we're going to look at pulling clinical data, then definitely engage with us, because those clinical exports, we want to make sure that you understand the measures really well so that we're pulling the right data out of your EMR for you, right? And there's a few other ways that you can report these measures as well. Different EMRs offer different, what they're called QRDA files, and we absolutely can take those in as inputs as well. So I guess maybe what I'm saying is a data plan. Have a data plan for 2022 and have it as early as possible. George, how do you select the right measures for your practice? This is a fantastic question. So one of the things that I did not show you today is we have what's called a measure analyzer. So we're going to take your billing data and we're going to run it through an algorithm against all 300 plus MIPS measures. And what that does is it gives you your eligibility, your denominator across all of the measures in the entire program. And then the consultant really walks you through it and says, okay, how do we think we're going to get numerator data? Because there's a vast difference in someone who's getting us numerator data either through claims or through clinical data versus someone who is planning to go into the chart and do audits, right? And fill out say a spreadsheet or whatever for us to tell us met, not met. Or if you're on paper, that's another place where we use that workflow. And so in those cases, obviously, the number of patients in that denominator for each measure is going to be something that is impactful. The other thing that's really impactful is you want to know where your billing lands, because what you are billing out represents the work your clinicians are doing. So if we choose measures that are reflective of the work they're doing, they're more likely to be engaged and they're more likely to care about the results. So measure selection is a key part of what we offer for MIPS, definitely. I think that's all of our preloaded questions.
Yeah. Okay, so we have some more questions. So before I take this off the screen, does anyone want to take a screenshot perhaps, or take down the phone number? I'll just give you another minute here. And if, all right, I am going so you can see Allison a little bit more clear. All right, so here we go, a few more. So is it too late to switch partners in the 2021 MIPS process? We are having a very difficult time with the current partner, who will remain nameless. Things dragged on in 2020 until nearly March 31st, 2021, and we continue to experience problems with them. Mapping and other terms I don't completely understand. 9.5 months into 2021. So basically, is it too late to switch partners?
Right. I would say no. I say it's not. It's again, it goes back to, yes, it's a 15-month program. Yes, we're 10 months in, but it's never too late. And in fact, you might, in this particular scenario, you might think about it from the perspective of risk mitigation. What is driving more risk for you? Is it riskier for you to stay where you are and cross your fingers? Or is it better to come and learn a new partner? And what I can say about us certainly is that we take on a lot of clients who at this point in the year haven't started yet, and we are able to successfully catch them up and get strong submissions.
All right. That's reassuring. All right. What if I don't have an electronic health records?
Ooh, that's a great question. That's okay. So for the quality component doesn't require that you have an electronic health record. And in fact, organizations that don't have electronic health records, I strongly recommend they work with a registry, because we have processes in place to support those paper practices. And we'll help you get reported what you need to report. If you are a small practice who doesn't have an electronic health record, there are also some things we can explore in regard to an exemption for the promoting interoperability category, which is the only category that requires that EMR. So it may mean that your quality category has a greater weight, and that's okay. That means we got to really knock that one out of the park with you.
Okay, great. All right, guys, so we have a few more minutes. So if you have any final questions while we have Allison here, this is the time to pop them into the chat or the Q&A. Otherwise, last question, Allison. What is the cost to the practice to engage your services?
So I am actually going to turn that over to, if that's all right, I'm going to turn that over to either Charles or Melody. We do have coupon codes for you guys that give you a sort of premier pricing on our services.
Yes, thank you, Allison. So
Sure.
we do have excellent pricing for you guys. We are going to do a 20% discount with the coupon code Coronis21. So the original pricing is $588. You do get a 20% discount, which is very great. And then if you just click on that link that Reset shared earlier, you put in Coronis21 as the coupon code, we'll make sure you get that preferred pricing.
Great. And make sure to mention this webinar as well. And we will be sending everyone the recording in a few days. So that link will be in that email again as well.
Great.
So, all right. So any final words, Melody or Allison, before we sign off for the day here?
You know, I think MIPS can be scary to a lot of people, and that's why we partnered up with Mingle Health, and I think they can just really give you that ease of mind and just help you along the process. I really like what they had to offer. I kind of vetted them first, and I'm a tough critic, so I think that this is a great partner for all of us, and I'm super excited for the partnership.
Yeah. And I hope you guys took away that even though it's October 12th here, it's not too late. We can still help, and we can meet you wherever you are at in this process. If you're struggling with another group that you're not happy with, if you haven't even started yet, wherever you're at, it's not too late. So I think that's really promising, hopefully reassuring. And Allison, any final words from you?
No, I think I think as far as final words, it's just that I'm really excited to meet some of the practices through Coronis, and definitely reach out. We're happy to have some introductory conversations. I think it's really nice to have that consultant just in your pocket, and sometimes they even serve as sort of a digital colleague that you can bounce ideas off of. So come meet us.
Absolutely. All right. Well, thank you so much for everyone that tuned in. Again, this was recorded, so you can always re-listen to it or share it with any colleagues. And otherwise, we wish you a good rest of your day and week and success overall. And we look forward to hearing from you. So thank you to our speakers, Melody and Allison. You were immensely helpful, and you shared a lot of really great knowledge. So thank you so much for your time today to set this up.
Thank you.
Thank you.
Bye, guys.
Bye.